Hello, I'm Dr. Frank Bucci from Bucci Laser Vision. I'd like to invite you to explore what we do here at Bucci Laser Vision, which is free people from contact lenses, glasses, bifocals, etc. So we perform surgery that allows you to achieve spectacle independence. Let's talk about dry eye and how it's important to both patients who are having eye surgery and to all our ophthalmic patients. And we have a lot of new technology that can really optimize the performance of the eye, especially for those having elective surgery and spending a lot of money and wanting to see well without glasses, without bifocals, without contacts. If they suffer from dry eye, it's going to not only give them symptoms that are unwanted, but it's also going to take away from their optimum result. So let's look a little bit about what's happening on the surface of the eye. The two key layers are an oil layer and a water layer. The water comes from your tear film, and again, when I say water, I'm being grossly general there. There's like 27 proteins within that aqueous watery fluid, but just as a means of talking about it, there's a water layer and then there's an oil layer. The oil comes from the 30 meibomian glands in the upper lid and the 30 in the lower lid. So the oil layer is so important because if it isn't thin and clear like a safflower oil, then the water evaporates from the surface. And a matter of fact, that's called evaporative dry eye, and it's responsible for over half the dry eye in the United States. Most people think, well, if I have dry eye, I'm short of tears, so I use my tear drops. I use my tear drops, and 5 minutes later I have symptom again, and I don't know what my problem is. It's because it's evaporative dry eye. So there's two specific treatments for the oil layer problem of dry eye. One, we want to take this particular kind of omega-3, which is not an ethyl ester omega-3 that you find in the drugstore, but one with a glycerol backbone that has 5 times the absorptive capacity and can achieve blood levels that will change the character of the oil in the oil gland. Thus, it will flow easier if it's not clogged at the exit point. If it is clogged, then we can apply LipiFlow, which will heat the oil from the component inside the lid, heats the oil from 98 to 108, and liquefies the oil, and then has pulsations and a massage treatment that really milks the bad oil out, and then the good oil that the patient's taking will be replacing that.